I just want to welcome everybody here today to our Lunch and Learn, and we're really excited to have you out here to discuss the ACA and its impact on the recovery community. If you haven't already, please feel free to grab lunch, eat as we talk. This is somewhat informal discussion. And thank you to the Wilmington Treatment Center, not only for the lunches, but also this really beautiful space that we're in today. My name is Jackie Mraz. I'm the program specialist for the program. I am a certified navigator and have been assisting consumers in recovery and the general public get enrolled in the marketplace since last fall throughout the open enrollment period and the special enrollment period. And I'm really excited to have you guys here today to talk about this important topic. So we are here today to answer a question that we have seen many consumers ask throughout this process, and that is, why is health insurance important for me in early recovery? As consumers, we're hoping to help answer that question, and for providers, we're hoping to give you this information to keep in mind as you work with consumers that might be new to having insurance. So before we get started, I just want to go over a few logistics. First, if you haven't signed in, please do. It's on the back table. We actually have two sign-in sheets. One is for my reference, and the other is a confidentiality sign-in for the treatment center. And if you need peer support credits or CEUs, please indicate that on the sign-in sheet. I will email those certificates out at the end of the week. Also, if you haven't grabbed a folder, please do so. This will be your Recovering Health Toolkit. There is a ton of information in there. Some of it is going to be provider focused, some of it's consumer focused, but we really hope that you can thumb through it and use what you can in your practice or pass it along to somebody that you know can use it. If you have questions about ordering more of those forms, you can email or call me or just catch me afterwards and I can help you get more of those forms. In your packet, you're going to find a pre and post test. Test sounds big and scary. It's not. It's just 13 multiple choice questions to get an idea of where you're at before we get started. If you could take a minute to fill those out, if you have a pen, that would be great. At the end of the discussion, we will have a post test as well. It's the same questions. We just want to see if you've learned something new throughout the process. This will also serve as your evaluation. So we've left a comment section for you to give us feedback, and this helps us for our future lunch and learns, what we can improve on. As you can see, we are filming the session today. Linda, our director over here, she is mostly going to be filming the speakers up here. She might pan the room a few times. If you do not wish to be a part of this film, we do have an opt-out form, which is also on that back table. And we just ask that you move to your right side of the room so you're not in the direction of the camera. As we have questions throughout after each of our speakers, we are going to ask, just so that she can capture it on film, that you come and stand on we have an X on the front of the floor up here, so that she can turn the camera and just film you as you're asking your questions, and then our panel or the speaker will answer for you. Bathrooms are located in the back. If you just go out the double doors and to your left, you'll see them. And just a friendly reminder to please turn your cell phones off. So before I get started, does anybody have any questions that I can answer? All right. So let's get started. So today we have 4 of the Alcohol Drug Council of North Carolina certified navigators here to talk to you. They've been active throughout the state of North Carolina, reaching primarily folks in recovery get enrolled in the marketplace, but they are often helping just the general public with questions. We have asked them each to share information on issues that they feel are important to consumers to be aware of throughout their recovery journey. They provide a really unique perspective on this topic because they are speaking from their own experiences as folks in recovery, as well as on the ground in the field navigators. So first we're going to start with our project manager. He's going to give us an overview of the ACA, and then we're going to move on to some more specific topics. And it's important to note that we've chosen these topics based on the struggles that we've seen consumers go through and the questions that they have through when they're trying to sign up through the marketplace. It's, often we think if we give people access to something, that means that they're going to sign up for health insurance and that they're going to know how to use it. But majority of the time, we spend a lot of our time as navigators kind of coaching consumers through not only the enrollment process, but how to use their insurance and why is health insurance important for them. So without further ado, I am going to introduce our project manager, Nee Mint. Nee has provided leadership throughout the course of this project, and he brings an extensive professional background to our team. He is a clinical social worker with experience in facility-based crisis and is a retired Army veteran. He'll give you a brief overview of the ACA, how the ADCNC got involved in the ACA, and touch on parity.
I think I can still say good morning. All right. So I appreciate everybody coming out here, and I do want to say this. Thank you for everything you do. I was in Herndon, Virginia at a Beltline conference a couple weeks ago, and it's important that you hear people at that level. They're talking about policy, they're talking about great change, but the reality is I found that a lot of people at that level, what you do is you kind of miss what we do here on the ground. So there's a lot of people in this room that are in the trenches every day. When you hear a lot of these things from 50,000 feet, they sound wonderful, but we're the ones that continue to work with the consumers and work our way through each of these individual challenges day to day, and we just kind of make it work with what we have. So I commend you for what you're doing, and I want you to know your efforts are not unrecognized. So the ACA is an enormous piece of legislation, and it's really not practical to take 1,700 pages and drop it on somebody and say, well, go ahead and read it and tell me what you think. So the reality is it's tough for us, right? It's even tougher for consumers. So we're going to make it really, really, really simple. Our hypothesis was very clear. Health insurance gives you access to more treatment. More treatment gives you a greater chance of recovery. That's the way our messaging went out. It was important because very few people make this huge decision about what to buy as far as a health insurance plan on the fly. So you had to provide threads and these little bits of motivation to lead people along to say, this is our website, this is our Facebook site, this is where you can call if you have questions. And enrollment was a multi-stage process, and that's something that we found as this whole project went along. But the core thing to understand here is keep your message very simple. You can't talk about ACA without at least addressing Medicaid expansion. I'm not going to talk a whole lot about Medicaid expansion, but I don't want this to be something that's this dark cloud that continues to hang over what happens in North Carolina. It's very complicated, and I imagine it's very discouraging for a lot of people that are working with consumers that don't have access to resources, don't have access to health care. We know what Medicaid does, but the ACA assumed Medicaid expansion in all 54 states and territories. The Supreme Court disagreed. Thus, North Carolina was one of many states that did not expand Medicaid. So how do we currently service this population? Well, we have IPRS, right? And IPRS covers many, many services, but it doesn't cover some of those things that we think are important to facilitate our recovery, because if I'm in the hospital or I have asthma, how do I get treatment or medication for that, right? And so is that something that will affect our recovery? We'll talk a little bit about that. How many people know what an 1115 waiver is? Anybody heard of that? Okay. So many states now, Arkansas was the first the state legislature of Arkansas approved 1115 waiver for Medicaid. So what this is essentially Medicaid expansion in everything but name. They're going to do this two separate ways. The first thing is they have a private option. So they'll use funding to buy plans through the marketplace for their consumers that are going to fall into this gap. Depending on how it works, if a consumer would benefit more from being in their Medicaid system, they have a means to transition them into the Medicaid system. And this is a huge, huge win for non-expansion states. Immediately after Arkansas doing that, many other states started filing suit, putting together packages for their legislatures to start looking at this. Okay, and some very initial early discussions about an 1115 Medicaid waiver in North Carolina are happening. So it's something to be hopeful for, and it's something on the horizon. So this is a pretty straightforward slide, and I have to admit I totally ripped this off from Center for Medicaid. It is a nice color, though. So we have our metallurgical levels, and it's pretty straightforward, too. Again, platinum plans cover more, cost more, where bronze plans cost less, cover less. But what I really, really liked about it are these numbers over here. My green laser pointer is horrible. So if you can't read it, it says the max out-of-pocket annual limit is $6,350 for individuals, or $12,700 for a family. Now, this is also a big win with the ACA. Imagine if you were 21 years old and you decided you wanted to try and ride a bull. And then you got stomped by a bull, and then you ended up spending 21 days in ICU. Happened to a friend of mine. If you don't have health insurance, you could end up very quickly with a six-figure bill that you will spend your lifetime trying to pay off. And that changes how your entire life unfolds, right? When you start your life that early on. I don't know if anybody's here is, in their 20s with, six-figure college debt. When you have a large number looming over your head like that, it affects the way you live your life, your quality of life. So this is a huge, huge, huge win. But understand, in this, you have to have a plan with the limits in place, an ACA-compliant plan. And I'll talk a little bit about that. So just remember, this is a win, even if $6,000 is a lot of money, I agree. But you can survive $6,000 at 20. Okay, so what are the two types of subsidies? Come on, it's on the slide. I can read it off, but so could you. So, and I'm just going to stand here and stare at you. Somebody say it.
Advanced premium tax credit.
Thank you. Wow, okay, so look, you know what, I want you to know something. I kind of got filleted about audience participation on some evaluations, so anything you guys could do to hook me up, I would sincerely appreciate it. I'll throw you a ham sandwich and some chips, and we'll call it a wash, right? Okay, so an advanced premium tax credit. So basically, tax credits are nice, we get them at the end of the year, right? But we're going to do it in advance. So when you get your premiums, the microphone's killing me. I know everybody can hear me, but okay, so better. An advanced premium tax credit. So if you get it in advance, when you have your premiums month to month, you can use it and apply it to your premiums month to month to reduce your overall monthly premiums. That's great. Or you can decide, I'm going to push all these premiums to the end of the year. So who does that, really? Actually, Jackie does. Other than Jackie, who does that, really? Well, what I would say is when you think about advanced premium tax credits, think about if you can accurately predict what your income's going to look like at the end of the year. Pam may be giving lots of people in here raises. You don't know, right? Bonuses. So that may change what you get at the end of the year. So, or you work in sales, or you have something where you have fluctuating income. So it might be a good idea to save some of those premiums to the end of the year. And that way you don't end up with a tax liability. The second one is cost sharing reductions. I didn't make you guys say that. Cost sharing reductions are for individuals at 100 to 250% of the federal poverty level. This was the big win. These were the big winners under the ACA when the marketplace started accepting applications. So cost sharing reductions can be used for things like coinsurance, co-pays, and deductibles. So it makes health insurance very, very affordable for individuals that fall within this range. As we look at what the federal poverty level is, you see $11,490 is 100% of the federal poverty level in 2013. That's the number we're using right now, and we're using it through this next year. Expect that those numbers change, and it's really based on the Consumer Price Index. And then the 400% of the federal poverty level is $45,960. So it's a pretty significant range. The benefits as far as the subsidies at 400% are obviously less to very little. The key thing that we learned from navigation is where that $11,490 is really, really important. So the next slide I'm going to show you is going to explain that. Who knows what the gap is? Not the panel. Anybody? Somebody tell me what the gap is. The donut hole. That's good. Who said that? Get that one? No, that's my boss. All right, you don't get a sandwich or a cookie. Okay, so I'm going to go ahead and explain this because I'm on limited time and Jackie's going to start throwing stuff at me. So at 100% of the federal poverty level, and you'll see this with my very pathetic green laser pointer over here, this white area over here, these are all the individuals that aren't going to be able to get health insurance subsidies through the marketplace because we thought Medicaid would expand. So How do we provide coverage for these individuals? I think it's extremely important. When somebody sees you as a navigator, they see an agent of the government, a representative of the government. So I need to explain this very clearly, because if you think logically the way people progress, they say, the less money I make, the more benefits I get. So if somebody unintentionally lowballs their income as they come through there and they say, well, I make about $500 a month, and I plug them in the system and they get no subsidies, it's really a shocker for them. But then I explain this and they say, oh, you know what? I make $1,100 a month. Well, the thing is, people are really, really hesitant to change what they say once they've already told you once. So what that almost ends up looking like is, let's set up a follow-up appointment. Let me see how much I can look up in some additional documents. So I find it's important that you go back initially and say, look, $1,000 a month, is what's going to get you the maximum subsidies. And I want you to think in terms of disability, mowing the yard, babysitting, whatever. Project your income, but $1,000 a month will get you the maximum subsidies. So that's really important to know and important to convey to consumers before they commit to giving you a number. You don't want anybody to lie. We do not encourage anybody to lie. What I'm saying is I encourage people to import things as accurately as possible. Okay. So I had to throw ASAM on here because I really am becoming more and more optimistic as I continue in this profession. So as we look at ASAM, you'll see a lot of different services out here, but something you will note is there some of these services are non-billable, substance abuse halfway house, and these are Medicaid service definitions. Looking at this slide, this is what I can tell you about the treatment continuum. And then there's plenty of naysayers, but you know what? If you work this system, it works. If you fund the entire continuum and you go down the continuum, it works. So why is it that we run somebody and they go to facility-based crisis and they go 5, 6, 7 times? Well, maybe because there's a gap, right? And as we go back and we start looking at how we're implementing healthcare and how healthcare is going to come across substance abuse treatment in North Carolina nationwide, you look over here and say, eventually it's going to be cheaper to fund this entire continuum than to pick and choose services that you see are holes in the system and then try to do that and assume somebody else is going to pick up that ball. So, something to consider. So the train analogy, this is a Mint original. I promise I didn't steal this. I still stole the little symbols, but other than that, I didn't steal anything else. So this is where my optimism comes from. If you go back 2 years ago, people would say 80% of the people in this country had the best health insurance in the world. Had great, great health insurance. And I was happy with my plan. I was happy with what I did. I was happy with my network. But this is where I'd go back and say, what about the other 20%? What did they get? What do they deserve? As you go back and you start looking at that, the measure of a great society isn't necessarily, how much wealth we have, how much power we have. It's how we protect the most vulnerable population, our most vulnerable citizens. And if those 20% are here, can we realistically say we're doing the best we can do? So as we go back and look at that and we look at the changes we made, what we're saying is we can't stay where we were. Okay, and this is where we want to be. Is the ACA the vehicle that takes us there? I don't know. It is the vehicle that takes us to the first station. It may take us all the way to our destination. But the naysayers that are going through and saying we need to kill this, we need to defund this, what I can tell you is you can't stay where you were. We're moving. So I want you to think about that. I want you to think about this as a journey as we go back in there and say, what are we going to do? What do we want this to look like in the future? You're killing me. All right. All right, so here we go. Okay, so let's talk just a wee bit about parity. I had an offline discussion about parity with Pam out in the hallway. It was just absolutely wonderful, but it's probably all those things that I probably shouldn't say on camera. So here's what I would say. First, number one, if you don't know how to pronounce it, the Mental Health Parity and Addictions Equity Act is pronounced MAPIA, and there are a lot of individuals that are working on it at the state and federal level. So both the state and the Fed are working on legislation with MAPIA. Now, how does that work here in North Carolina? As you go back there and we start looking at parity in North Carolina, the North Carolina Division of Insurance does a lot of wonderful things, and they're like hidden in some cubicle in some building without windows. But they're really, really motivated people, and they know what they're doing. So they're looking at these plans to see that they're ACA compliant. And if they certify a plan as ACA compliant, it has to meet parity regulations. And they want to know. If you have a plan and you've got a provider that's coming through there that's not providing services that you think meets parity, report it. Report every single one of them, because there's lots and lots of people that are waiting to see this, to go back and challenge this, to make sure insurance providers are providing what they should as far as parity. So there's some other agencies and oversight, but the last thing I really want to kind of talk about on this one is the non-quantitative measures of parity. So what is that? A non-quantitative measure of parity is if you're an insurance provider and my provider network, and I say I have this provider network and here's my substance abuse providers, but what if I'm in Murphy? Who knows where Murphy is? Yeah. Man, you guys are killing me. Lively, somebody lively. So Murphy is on the far side of the state, but what if you have only one substance abuse provider in Murphy? Is that adequate network availability? What if that substance abuse provider is an LCSW that just graduated 2 months ago, that's an expert in individuals, couples, families, groups, veterans, geriatrics, adolescents, neonates, and I'm trained in trauma, substance abuse, eating disorders. You had one heck of a field placement because I didn't get that. So those are important things and questions that are going to come along when we go back and say, what is parity? So, okay, finally, some very, very important dates. I'll leave this up there for about 10 seconds so everybody can jot it all down. But if you jot anything down, this is what I want you to do, is get that number. If you have a question, if you have some burning desire that wasn't answered, call us. If you have something and you think it doesn't meet parity and you don't know what to do with it, call us. Call those over there. Let us help you. Let us feed you the information. I have this wonderful black book that I write in questions that I can't answer, and I hunt down answers for it. So something to consider. Please keep our number and call us if you have questions. Thank you.
All right, and this slide actually is in your slide packets if you picked one of those up. If you didn't, they're in the back of the room. So we just want to open up the floor for questions now for me. And like I said, we're going to ask that you come up and I'll hand you a microphone and we'll kind of go back and forth. If you don't want to be filmed, that's fine. I'll hand you the microphone at your seat. Just won't be part of our film. So, anybody have any questions? All right, so obviously this is a really complex topic, not something you can cover in 10 to 12 minutes, so maybe you'll come up with questions later on as you go. Always, you can reach out to me or Nee, or any of us actually, and our contact information is in the back of your slides. So throughout this open enrollment period, we've learned we're working in an ever-changing environment right now, so we kind of fly by the seat of our pants with some of these things. But one thing that stayed consistent is that our goal is to best assist our consumers. So that's why we've chosen the topics that we have today that the 3 remaining navigators are going to talk on. So I would like to introduce Tracy Penniger. So Tracy is one of our certified peer navigators. She has a background in nursing, and she's provided navigation services across the state, primarily in the Charlotte-Concord area. She's well connected in the recovery community and has worked with agency staff to train their staff to help consumers, as well as one-on-one with consumers to help utilize their health insurance. I know she spent hours on the phone with insurance companies helping work out technical issues and all sorts of things with consumers. So one of the lessons learned is that when we often meet consumers, they haven't had insurance for many years, if in their lifetime at all. And especially if they're in early recovery, they might not have been focusing on their medical health for a long period of time. And as we all know, drugs and alcohol take an extreme toll on your body. So Tracy's going to discuss the enrollment process a little bit and point out key facts to keep in mind through that process. And she's going to discuss the ways that drugs and alcohol can affect the body and how she kind of coaches her consumers through the reason why it's important to see a doctor now that they're entering into recovery. Tracy?
Hey, and thank y'all for having me. My name's Tracy. I've been in recovery since December 3rd, 2011. And addiction in the body. There's quite a bit that when we first get into recovery, we're thinking about, our mental health, our emotional, our spiritual health. And those are the things that I concentrated on a lot when I first got clean. Trying to recover my family, trying to gain back trust. But in the meantime, I had several medical conditions due to my drug use that I had developed and did not even realize that I had until my physical health started really going downhill. And at that point, it really impacted my emotional, my mental, and my spiritual well-being. So that's why this topic's important to me. But we're going to talk a little bit about drugs and alcohol and the effect. And when I say drugs, I'm also including alcohol because alcohol is a drug. The effects on the heart. Can anybody tell me about crack cocaine, crystal meth, the effect on the heart? Would you have a tachydysrhythmia or tachyheart dysrhythmia, or would you have something more of a slow bradycardia arrhythmia? Tachy? Okay. Well, you're partly right. On the initial use of crack cocaine, crystal meth, any stimulant, you will get that initial heart racing. But over a period of time, you actually cause the heart muscle to enlarge, which causes congestive heart failure, cardiomyopathy. Some people I know have even had to have pacemakers put in. And when I say long-term use, if they went at it as hard and heavy as I did, that could be as little as 6 months. So you just have to take each client into consideration. So you were partly right. You get credit for that. The effects on the brain. When we start talking about the impact of neurotransmitters, and those of you that may be medical, you know that's a complex system. The brain is a complex system. But neurotransmitters and synapses are essential to brain function at all. And what happens during alcohol and drug use is that those neurotransmitters kind of go wild. The synapses go wild, depending on the drug that's being used. And crack cocaine, crystal meth, of course, is going to cause an increased firing of these neurotransmitters. The other drugs actually slow down. You know, heroin, opiate users, it actually slows down and burns up the synapses and the neurotransmitters, which in turn causes the memory loss. And I too suffer from short-term memory loss and didn't realize it until family and friends were telling me I was asking them the same questions 4 times a day. And I still do that, but I've developed strategies to avoid that and to make my life a little bit more easier. Jackie can attest to that too. Headaches and strokes, that comes from the vasoconstriction from stimulants. Or it can also cause from blood clots from the decreased blood flow to the brain from opiate heroin use. And that the headaches you'll see a lot in early recovery, and that's because the synapses and those neurotransmitters are trying to recover, and they're saying, okay, what happened? I don't have that extra firing going off, and they're just kind of in limbo. When you talk about the blood, you're talking about the immune system, you're talking about hepatitis, infection, and early recovery. These things should be looked at so there could be treatment given as soon as possible. Gastrointestinal, really big. That goes for alcohol and drug use. You're looking at bleeding ulcers, malnutrition, gastroparesis, esophageal varices, and it also affects the immune system. A lot of your immune system is in your gut. Heroin and opiate users suffer severe gastrointestinal problems if you've worked with them when they're initially getting clean, and that's because the stomach is waking up. You know, all these nerves that they've deadened, it's all waking up. They suffer nausea, vomiting, severe diarrhea. Also, going back to the neurotransmitters and the synapses, they'll have leg cramps, leg tingling, difficulty sleeping at night because of the pins in their legs. We're going to move on to dental problems. One thing that the ACA did that gives everyone the same opportunity for dental insurance. A lot of people in recovery, dental insurance would be a luxury. This would be something that would be put on the back burner. You know, food, housing, that type of thing has to come first. So this gives everyone the opportunity to have the same benefits and to get the same type of care. And you can pretty much read the slides for yourself, but I am going to add that when smoking any of these substances, you have to look at what the substances are cut with. They're cut with strychnine, boric acid, and sometimes arsenic. That's why you see the dental decay and the rotting and the severe gum disease in crack addicts and crystal meth. And gaining dental insurance for these people not only gets their dental health back, but it also provides them confidence. You know, they may be in a recovery house working hard to get a job, I know that a lot of them, when I talk to them at these events that I go to, they'll cover their mouth, they'll hold their head down. You know, they're ashamed of what their teeth look like. And so this actually helps build their confidence. They don't even want to go to meetings because of the way that they look. And so this gives everyone the same opportunity across the board. And the ACA offers all essential health benefits. This, I think, was a big, big win for the Affordable Care Act. And what's not on here right now is one of my favorite things about the Affordable Care Act is there is no pre-existing condition. That right there in itself was a big win. Insurance companies didn't like it, but that was a big win for people in the U.S. I had a client, I signed up, she got her little policy. She went and had her mammogram the next week under the preventative care there and wellness services down there at the bottom, and she had breast cancer, undergoing chemo, radiation, a radical mastectomy, and reconstructive surgery. If that would have happened prior to the Affordable Care Act, she would have probably died. She lives pretty much in the project list, paycheck to paycheck, makes just enough to make that federal poverty level we were talking about, that 11.4. So these benefits are essential. In the mental health and substance abuse areas, it's not only initial treatment and the 28-day program or maybe a 6-month program, but this goes on to psychiatrists and psychologists for ongoing coexisting mental health conditions. I myself suffer from chronic depression or severe depression. So, and the longer someone's out there, the longer they've used, the more mental health issues that they may have, and this is really, really important. Prescription drugs. Many clients that I've worked with couldn't afford their blood pressure medicine, couldn't afford antibiotics. This gives everybody the same opportunity. It just evens out the score across the board. And choosing a plan. If anybody's kind of looked at the marketplace plans, it can be really confusing. When I know that when I first got clean, I didn't have 2 pennies to rub together. Insurance was the last thing on my mind. But I had to do something for my physical health so my recovery wouldn't suffer. And when you're looking at these plans, the individual, or if you're helping an individual, keep in mind what's realistic for them. You know, I've been asking clients, okay, can you afford a $500 deductible? And most of them don't know what a deductible is. You know, do you have that? Is there someone you could borrow it from? And so keep that in mind, make it realistic for them, as well as their co-pays, any specialist referrals. You know, they may not have $20, but there may be another plan that has a $10 copay for a specialist. And a lot of our plans do have a zero deductible, so that is able to reach and help a lot of people in the recovery community. And some basic testing for providers. And again, this is included into a lot of the wellness and preventative care, so that would be covered pretty much automatically. I'm not for sure exactly which ones, but I do believe that like the CBC and the comprehensive panel would be. When you're looking at the CBC, you're checking for anemia, immune status. The comprehensive panel, you're looking at kidney and liver functions. Any type of drug or alcohol abuse affects the kidneys and the liver, which could go into cirrhosis or liver failure. Mini mental exam, real quick for y'all. And don't write it down, don't cheat. Red, truck, and ball. Remember those 3 words. The mini mental test you can do, social workers can do it, nurses. PPD testing, the test for tuberculosis, testing for STIs, and then they can determine more comprehensive testing. And providers. This have been my clients' wish list. You know, if they could say what they wanted, this is what they would like to see. That y'all play an important role in their health, in their well-being. Foster a non-judgmental relationship, you know, during your conversations. When you're asking the clients about their drug use, they may minimize their use, meaning, you know, I only used on the weekends, but I've been using for 30 years. Well, you put 2 and 2 together, that doesn't really add up. We all know it escalates. But they do that out of shame and embarrassment. Keep the language simple. There we go back to the memory loss and the retainment. and provide written instructions. That also goes back to the memory loss. And when they come back for their test, be real careful when you're telling them sensitive information, such as an HIV status or an STI status, because they may not mentally be prepared to handle that. Be prepared to spend some time with them and give them the follow-up care that they need. And again, this may be their first visit with a physician or a healthcare provider in many, many years. Going back, who can tell me those 3 words? One person. Good, you have no memory loss. I'd like to thank y'all, and again, I'm going to give it back to Jackie.